You may have heard a lot of things about pelvic floor health. I know as a woman, it's something I've been hearing for probably decades. And there are so many misconceptions of what it means, how it works, what types of exercises are useful and what types are not. We all are familiar with the Kegels and whatnot. But today we are going to really dive deep into this subject. I have with me Dr. Nicole Fleischmann. She is a pioneering urogynecologist who is transforming women's healthcare through her groundbreaking second mouth concept. Cannot wait to dive into this. With over 25 years of experience, Dr. Fleischmann blends cutting edge medical expertise with ancient wisdom to empower women and address the crisis of silence around intimate health issues. She is the author of The Second Mouth, and as an author, she offers a unique perspective on women's health, combining her medical expertise, her clinical expertise, with a mind-body connection. And forget what you are thinking about mind-body connections, because she's already blown my mind in our conversation before we began recording this. So I'd like to introduce you to Dr. Nicole Fleischmann. Welcome to the show.
Thank you so much, Carol. It's so nice to be here. Thank you for having me on.
Thank you for being on. Excited for this conversation. So I actually want to start with that mind-body connection because that was something I had never heard before. Can you just explain that a little bit to our listeners and those watching as well?
So the mind-body connection has, it has a lot of definitions, but I think we can have one that's really concrete. Anything that your mind can do that can affect your body is a mind-body connection. And when I think about how I help my patients make mind-body connections, I'm trying to get their mind to focus on something that's on the other side of their body. And this is where the pelvic floor lives. So building pelvic floor awareness, becoming aware of the muscles on the other side of your body is not easy to do. We're not born with that connection. That's something we have to build over time. And this is a developmental problem from early childhood, where we learn to move our muscles, move our bodies, overcome our instinctual natural reflexes to be more purposeful in the movements that we make. And the pelvic floor is probably the last muscle in the body for us to become aware of, because it's the furthest one from the brain, so to speak. It's at the very bottom of our trunk. It's what we sit on. And so for our brain to be connected to that muscle, we have to have some cues. We have to, first of all, know it's there. We have to know what it's called. We have to have someone talk about it. We have to touch it with our finger. And because none of those things really happen for us as children, usually, we don't really know that muscle is there. It's sort of like a blind spot in our brain. So that's really a brain disconnection. When your brain doesn't see a certain part of the body, it changes everything for your body. Your posture, how you breathe, how you stand, how you think, how you control your nervous system. When you have a blind spot in your brain, you have to build a connection to it to overcome that. And so that's what I help my patients do. How do we know our pelvic floor is there? And I work with my patients to learn about it and where it is in their brains.
That's just fascinating because I had never ever thought of a connection of our brain and the pelvic floor and really making that connection and being in touch with what we're feeling.
Yes.
So when we think about the pelvic floor, okay, you have a book called The Second Mouth. How did you come up with that title? That's a great title.
So that title was an evolution in my understanding of what the pelvic floor actually is. And I think one of the reasons, as you mentioned, that there is so much misconception about the pelvic floor, what it is, what it does, what exercises we should be doing for it, is because we don't really understand what it really is, which is a mouth on the other side of our body. Okay, so we are two-mouthed creatures. Actually, biologists call us deuterostomes, which means two-mouthed creatures. And all the members of the animal kingdom have two functional mouth mechanisms, and that comes from embryology. So we're going way back in time to understand why we have two mouths. But the lower jaw of our mouth is functionally very similar to the pelvic floor, both in its neurology and how it moves. But because we don't know we have a mouth on the other side, we never learn to open it. And that lack of opening of the mouth is what causes us problems with urination and defecation and childbirth. We have a mechanism on the other side of our body that can open our mouth, but we don't know it's there. So because of that, we all just push. And this goes back to early childhood toilet training. So I don't mean to blow your mind too much, but what the book is about is just this understanding that none of us have been toilet trained correctly. Frankly, we haven't been toilet trained at all. We've only learned to hold. But we've never really learned as a species to release urine and stool from our bodies in a coordinated way. And that's really because we haven't learned to open the mechanism of the mouth below. And that's the mind-body connection we need to make. And it's actually so easy to make. We could do it over the phone. It's something that you just need to understand. And it's called your sniff.
Sniff.
Your sniff. Do you know what a sniff is? A sniff is a facial maneuver. It's where you take a quick inspiration through your nose. It kind of looks like this. Can you
Okay.
do that? Take a sniff. Yes. So when you sniff, you can't move any other muscle in your body. You just want to use your nose. So it's you're relaxed completely. Your whole
Okay.
face is relaxed. Your chest is relaxed. And you're just figuring out how to bring air through your nose with a quick pulse like this. Yes.
Okay.
Try to purse your lips a little bit, Carol.
Okay.
Yes, that's
Better?
it. Yes. So when you take that sniff, what you're going to notice is that your belly pops out. Okay. Do that again. See if you can do that. Do you feel your belly pop out?
Yes, I did.
Okay, so now we're doing a little neurophysiology here, okay? That's our sniff reflex. So when we sniff in, our belly pops out because that's an engagement of our diaphragm. Okay? The sniff reflex engages the diaphragm. And, in medical school, I learned that when you do sniff inspiratory pressures on people, that's how you measure their pulmonary capacities and their phrenic nerve, if it's intact. So we know about the sniff inspiratory pressures. So your sniff is what's going to engage your diaphragm. It also engages your pelvic floor. So if you just put your attention on the other side of your body when you relax your bottom and take a sniff, you can feel the air pressure hit your bottom. See if you can do that. Take a sniff. Yes.
Yes, right away. Right away.
Okay, that's a brain connection, my dear. So that connection between your sniff and the other side of your body is how you learn to breathe. Breath goes through the body. And now you're getting to the heart of what's really going on with us. We don't know how to breathe. We don't really know what a diaphragmatic breath is. We all think we know what it is, but very few of us really understand what it means to breathe with our diaphragms because it always starts with a sniff. And when you do that type of breath on the toilet, you're releasing urine in a coordinated way. Pushing out our urine, we are opening our bottoms. And it's a totally different way of urinating, and it's better for us, and it's better for us with age. Because if we don't learn to release urine properly by the time we hit menopause, let me tell you what happens to us. And this is really a different way of looking at the pelvic floor, but in my opinion, it's the only way to look at it.
Wow. Wow. You are blowing my mind with this.
I told you. I told you. I said, hold on tight, Carol. You're going to hear something you never heard before. But this is really, really a different understanding of the human body and how it's designed.
Now, we've always heard about these Kegel exercises, and I know that as far back as I can remember, it's almost like we're taught to tighten up. And like you said, that pushing, I was thinking of so many things as you were talking. So, first of all, our society is almost conducive to it. Rush, 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 rush. Gotta pee, run in the door. I mean, I've done that a bazillion times. Okay, I've got 2 seconds. I'm hopping on a call. And I'm not thinking about anything. It's like, go as fast as you can. So I'm assuming that is not a good idea. What about all these Kegels and tightening the pelvic floor when we lift weights? Because I lift a lot of weights.
Okay, you just hit on three things, and I would love to touch on each of them because they are all important. All right, so let me go back to the very first one, which is where you talked about our behaviors and how we are really rushing through our day and we're not thinking about how we urinate. So, I have a very, very large clinical practice. I mean, I see sometimes, 150 patients a month. So I do see a lot, and I do a lot of surgery and procedures too. But I can tell you that the most of my patients are not aware that they're pushing out their urine. It's a completely unconscious behavior. And pushing out the pee, it doesn't always feel like it's forceful or strained. Really, it's a postural maneuver to release urine. It's either even just holding your breath to start your stream. These things are so subtle in our bodies that we are not paying attention to them. But unfortunately, they're not how we should be releasing urine. So this whole idea that I don't need to pay attention to how urine leaves my body, I don't need to pay attention to how air enters my body, those things are all done for me. That's a childhood mentality. And that's why I think that until you understand that you are responsible for not only air entering your body, but how it enters your body, what are the muscles doing to engage your diaphragm? Are you pushing your belly out each time you breathe? There are a world of dysfunctional breathers out there. I can tell you, most people do not know how to breathe. They are upper half breathers. And they don't understand that lower half breathing is how the human body is designed. I mean, if you polled the average person, they wouldn't even know what a diaphragmatic breath is. And yet that's how you're supposed to breathe. And so I tell all my patients, until you learn that breath is your job, that paying attention to how urine leaves your body is your job, these are things, this is how you graduate child development. Things aren't done if your body does these things for you, it's not going to be coordinated. If the body's initiating your breath, if the body's initiating how you pee, your brain's not involved. And that's a discoordinated state. Okay, we need to direct these processes with our brain. So that's where the sniff comes in. The sniff is the maneuver to release urine and stool from our bodies, and it's the maneuver to breathe. We have to get the blood flow to our bottoms. We can't be walking around clamping all day. That's also a childhood behavior that none of us have kicked. We're all walking around clenching, thinking that we are responsible for holding in our urine, and we're not. Our body does it for us. All it wants is air. And until we learn core expansion and how to bring air to the bottom of our bodies, we're all going to be suffering with incontinence and infections with age. So this is how I look at the body. It's a very holistic way, but it works really well for my patients. And we turn all sorts of things around, like incontinence and infections. And we just teach people how to control things by learning how to breathe.
Now, age-wise, are you seeing this like young, somewhere in the middle, midlife, and older? Is this something that is starting like we're in our teen years? And you mentioned childhood. Maybe it's starting all the way back in childhood. And then as we're developing and then have children, that's when this problem becomes, to the forefront.
Symptomatic. Okay,
Yes.
so we're talking about root causes, okay? So pelvic floor dysfunction is something we are all born with. It's a universal condition. Just think about it as a developmental condition because like I said, your job is to connect to all the muscles in your body, including your pelvic floor. If you miss the last muscle because you don't know it's a mouth and you don't know how it moves, you will always have an underlying brain-body disconnection. And that will take various forms throughout your life. Sometimes as a young child, it's chronic constipation. Constipation in childhood or bladder and bowel dysfunction is another health crisis, and it's another suffer in silence type of thing too, because I think at least 50% of children suffer from it. If they just learn to sniff, to open their bottoms to release things, they would do a lot better. But here's the thing, that brain-body connection is also a cognitive milestone. You cannot teach a 3-year-old who's learning how to release things to sniff out their pee. They're not going to be able to make that brain connection because their cortex has not developed enough. I would say around the middle school years is when we can really start talking to children about how things should be released and that we're not supposed to push. And we're not supposed to use postural maneuvers to release things because they will cause us problems as we get older. But we don't teach kids anything like that. In fact, we go in the other direction. Conditioning our children to suck in their stomachs. And sucking in the stomach is one of the most unnatural things that a person can do. And here you and I might have some differences in how we see things. But I am pretty sure that as a human animal, we were not meant to suck a thing in because we're not creating space for our organs to move. And we're decreasing blood flow to the other side of our bodies. So we need to learn to breathe through everything.
Mm. I actually really agree with that. I used to do bodybuilding fitness shows, and you got up on stage in your bikini. It was bikini bodybuilding shows. And the whole deal is you had to pop your rear end, your glutes, and you had to pull in your stomach at the same time. I had so much trouble, and it was so uncomfortable and painful. And I remember just practicing for hours because you would pop your glutes and, you know, all the rest of it would go for all the rest
Yes.
of it would go
Yeah,
forward.
unnatural.
And then you'd
Unnatural.
and then you'd pull in your stomach and your glutes with your butt would tuck under and it's like, "Oh my gosh."
Yeah, and
And
that's called vagina and butt clenching. That's what I call it. And listen, I tell people you're not supposed to be butt clenching. Most of us are not even aware we're doing it. It's totally under the radar. So what I'm trying to get people to pay attention to is that butt clench is actually called your guarding reflex, okay? It has a name. And the guarding reflex is an infantile reflex. We're all born with it. And it's really part of our fear reflex. So in terms of the whole picture, it's really the tendon guard reflex. So when we are in, a scary situation, every part of our body clenches up, okay, including our pelvic floor and our jaw. And this is a normal physiological thing when our sympathetic nervous system is activated. The problem is that if you're walking around with chronic stress and a chronic fight or flight state, you are butt clenching all day long and you're using your butt clenched to actually manage your emotions. And you're totally unaware that you're doing it. And it's a very excellent coping mechanism because you get to feel calm in your brain, but your butt is as tight as you can't believe it. And you're cutting off the circulations. I often see a lot of women with irritable bowel and all these bowel conditions, and they don't realize that they're just butt clenching so tight. They have no connection to that muscle on the other side of their body. So when I say take a sniff, take it down, this is the first time they've had any blood flow in their anus in their entire lives. That's how bad this is. This is a real condition. I see it in all women to a degree. It's a spectrum disorder. But the people who end up in my office are the ones that are really having severe symptoms.
I'm assuming the symptoms like perhaps back pain,
Yes.
incontinence, what other symptoms should women be looking out for?
Lower back pain is a huge one. If you have severe lower back pain, that's a postural problem and that's a butt clenching problem. Okay, at its heart. And I would say that, yeah, maybe that does lead to spinal stenosis down the line with age. If you're cutting off the circulation by clamping your muscles so tightly on the other side of the body without awareness, you're going to cause yourself physical harm. We need blood flow on the other side, especially when we're walking around. Human beings were the first creatures to attempt bipedalism, the first ones. And it's a very difficult position to be in. Standing up and walking around and leaving our pelvic floors at the bottom, they get no blood flow. They just get our weight. And so we have to provide air to the other side of the body. If we are chest breathing with an open mouth breathing all the time, we are literally cutting off the circulation. And that causes physical harm to our lower backs, to our colons, to our bladders, and pain and chronic pelvic pain. I mean, I can't tell you how many people come into a chronic pelvic pain. And I just say, take a sniff, and it's the first time they realize that they just had a release. They don't even know they're doing it. It's just this human. We are the most interesting creatures. I've been studying us for a long time, and I can tell you that we are interesting, but we also can get out of our pretzel. We're all in like a pretzel. I call us, we're in the Ouroboros. We all have our tails in our mouths, and we need to pop our tails out of our mouths to find our flow. Okay? The sniff pops your tail out of your mouth so that you can breathe. And we need to just teach this to people. We need to understand what our flow is. We're all backing ourselves up.
Wow. Yeah, I've been kind of practicing it as you're talking, and you're absolutely right. That connection is almost instantaneous when you're aware and you're thinking about it and doing it correctly. You said something about open mouth breathing. So I've heard so many things. I've taught yoga, I've done tons of yoga, and often they'll make you kind of purse the lips or close the mouth and just breathe through the nose. Should we be doing both all the time or one or the other?
So the nose is our airway. Okay, and we really need to understand that our airway is our nose. Our mouth is multi-purpose. We can do a lot of things with our mouth. Okay, we eat, we talk, and yes, we can take air into our mouth. But that is an emergency situation. The air that goes through the mouth is not filtered. It's kind of like garbage air. When you breathe with your mouth, everything gets into your body. But the nose has a filtration system. Not only that, the nose is connected to our nervous system in a way that the mouth is not. So when you take a sniff, you're actually feeding your brain air. You're feeding your brain blood flow. You're activating your diaphragm. You're activating the normal physiological processes of breathing. When you breathe through your mouth, it's just postural ways of taking air in. And that's what I'm trying to get people to not do. Postural maneuvers to do things that we're supposed to be doing in a certain physiological way. And we're smart enough to learn that. It's not that someone just has to tell us how to do it, but we skip that step. And this is really what I want to say about the wellness industry. Because listen, I was an allopathic, I'm still an allopathic medicine trained person. I practice at a hospital. I do surgeries and all those things. But I understand that if we don't know how to breathe, we're skipping a major step in our healthcare. Um, and 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 it's totally fixable. It's just about education. And I don't understand how we could have skipped that step. I just don't understand. It's the most basic thing.
No, breath is so important. That is something I've learned through my health and wellness journey and interviewing so many people on this podcast. That subject has come up, and you think it's kind of two-way. Your brain needs that proper breath, and then the pelvic floor needing that proper breath going back and forth. So that's making sense to me. And I'm thinking about how we get into poor habits. You talked about, childhood. I had a very anxious childhood and a lot of unpleasant things happening. And so that wasn't in my favor. And I got in the habit of breathing that top half breathing. I carried into adulthood, and I worked on that extensively. And then I thought about, people that have kids that have bad allergies. I had horrible allergies. So half the time I couldn't breathe out of my nose. How do we maneuver around those types of things?
So it's all about education. By the way, thank you for sharing that, and I completely relate. Listen, we all had traumatic childhood, and they talk about the big T's and the little T's. I would say that just being a child is traumatic. We don't have a lot of control over our world or our lives. So, many children experience trauma who aren't in, objectively traumatic situations. So I'll just say that for one. And I also relate to having childhood asthma. I also had really severe childhood constipation. And I had it actually for most of my life until I learned how to overcome it by learning the proper dynamics of my body. And I think the earlier you hear these things, no matter what you're going through as a child, the more you can incorporate it. If someone had just told me as a little kid, don't push, just sniff, I could have figured that out. But without somebody giving me that information at a time when I really needed it, I suffered for much longer than was necessary. And I think it's just about awareness. Most pediatricians don't know what to do with childhood constipation or the pediatric gastroenterologist because we're not understanding these basic physiological processes of how our breath and our stool and all those things are on the same nerve pathways and they're physiologically connected if you understand how they work.
Yeah, I had the same problem with childhood constipation that wasn't resolved until adulthood. And then having raised three kids, I had two that went through that. One did not, but one in particular will still struggle to this day. She's an adult, and it started very early. So I can relate to what you're saying. And you go to the pediatrician, and a lot of the advice, it's not
Eat,
very
eat, eat
helpful.
these chocolate laxatives. That's what you get.
Yes,
I had
yes,
one of my children also. But listen, I wanted to get onto another subject, which is really important. I don't want to miss it because you did talk about Kegel exercises,
yes.
and this is a huge subject. So one of the things that happens when people come into my office is I'm asking them to do undo conditioned behaviors, and stomach sucking and Kegel's exercises are the two things I'm trying to get them to undo. And it's very hard for me because every other person in their life has told them to do these squeezing exercises. And even very reputable people in our field tell everyone to do Kegel's exercises. And it's just an outdated concept. There is no data that shows Kegel's helps anybody. In fact, I would tell you that it probably makes most people worse. Using those muscles at the bottom of your body when you don't have an awareness of how they move to clamp tighter is like taking someone who has temporomandibular jaw dysfunction and telling them to clench their teeth tighter. When you understand the concept of the second mouth, you understand why Kegels don't make sense. We are born with a closed mouth. We don't need to tighten just because we're pushing through our teeth and our teeth are falling out, so we have to clamp tighter to seal the hole from our teeth falling out. What we need to do is relax our jaws and open when it's appropriate and close when it's not. We don't need to tighten any more than that.
So when we're doing planks is a big one. And I have coached when I was personal training so many clients on planks. And the wisdom at the time was pull that navel up and in. And when you do that, it's just natural that that pelvic floor is kind of pulling. Should we be doing planks? And if so, how should we be doing them so that we're not clenching?
So I'm not an exercise physiologist, and you may even understand a lot more of the exercises that I don't even understand. But I will tell you this, I don't have a problem with any exercise. Some of my patients are so athletic and they do all sorts of things that I can't even conceive of. But I do say, listen, when you develop an awareness of your other side of your body, meaning you know how to sniff and release your muscles, whatever you're doing in your exercise program, you're going to be able to counteract it to make sure that you're not walking around clamping after that. You have to learn to take it down. I personally don't understand how clamping tighter is good for you, but I do understand how elongating the body. So I really talk a lot about posturing. And I think this is a lot about what Pilates is about, although I've never
Yes.
taken Pilates. I do take yoga, but I don't take Pilates. But I think in Pilates, we're learning about the importance of keeping our spine straight. So I do a lot of posturing with my patients, and I have them in a lean forward position at their hips, and I teach them to let their bellies go. And people don't like this because it makes them look like they have a 9-month pregnancy. But I'm not saying you don't have to do this for your life, but you have to learn to disengage your core. And I think that if we can understand that if we just stand up straight with a disengaged core, we do have a flat, it's not concave, but it's a flat stomach, and it allows you to breathe. See, if you can't expand your lower abdomen, you can't breathe. That's part of breathing. Remember, it's called belly breathing or diaphragmatic breathing. We are supposed to expand, we're not supposed to suck in. And so it's just this whole concept of learning how to posture yourself based on your breath. Because if you can't take a lower half breath, you're not standing right.
I'm going to be really aware of these things. You're bringing up really good points. So I actually go and work core. After our interview, I'm going to go to the gym, do some core, do some lifting, and I'm going to do a plank and I'm going to see if I can't employ that relaxation a little bit but at the same
Let me
time keep
know.
that, yeah, and same time keep the integrity of it. Well, it's interesting. There's an exercise physiologist I followed, Deborah Atkins, I believe her name is, and she stopped giving that advice of pull your navel in, and she made reference to the pelvic floor. So it's interesting.
Starting to come together.
Yes.
It's funny because when I talk to my patients, and maybe this conversation is jogging things for you too, everything I'm saying you've heard before. And I always say to it, because a lot of my patients say, I've never heard this before. I've never heard anything like what you have said before. And what I want to say is, you have. You've heard it all over the place, but you've heard it with different language. And this is really why I think we've gotten into this trouble. We don't have the language to describe these inner body processes that we feel. It's very hard to speak about them. That's why most people don't know they're pushing out their pee. They just don't even know how to describe that. We don't know how to describe that postural maneuver to each other. So when we develop the language to talk about these things, which is what I've been doing, we suddenly realize that we all kind of understand these principles. Like we've seen them all over, but they've never come together for us in a coherent way. And that's why the pelvic floor is such a mystery to us. So let's just call it what it is, the mouth on the other side that opens when you sniff. So when you breathe, you're supposed to feel your butthole open up. That's part of breathing. If you're chest breathing, you will not feel that. And sometimes you have to lean forward a little bit and you have to disengage your abdomen. But that's proper breathing. And if we don't learn that as a species, we don't know how to pee, we don't know how to poop, and we don't know how to deliver a child because we're supposed to push with airflow. We're not supposed to push. If we don't want to damage our bottoms, we have to open the mouth.
Never heard that before. And I know a lot of my listeners, they have like grandbabies on the way and daughters who are pregnant. So really good to have that information. So there's childbirth. Now, what about a lot of women wind up getting a hysterectomy, either a full or a partial? How is that affecting the pelvic floor?
So, I mean, some people need to have a hysterectomy for cancer. Some people need to have a hysterectomy for fibroids. Some people need to have a hysterectomy for prolapse. And there's different schools of thought on whether the uterus should come out, when it should come out, what direction it should come out from. But in general, I think with pelvic floor support, the uterus is not the support of the body. We really, I hate to say it, we don't need our uteruses after we are done having children. It doesn't serve any purpose in our bodies that we know of. The ovaries, yes, the uterus, not so much. But the support of the uterus, all those ligaments and tendons and muscles, they need to be intact. So sometimes when we do have a hysterectomy, we do get damage to those muscles and those ligaments, and that can cause problems for our pelvic floor. But what really creates problems is not just surgery or the things that have happened to us, but our behaviors. So this is how I sort of feel about childbirth related injuries. When you push a baby out through your bottom, whether or not you open your bottom mouth, you're probably going to get a little bit of damage because childbirth is one of the most scary things for any woman to go through, and your sympathetic nervous system is just soaring. And so for you to be calm enough to deliver a baby, which happens to be a parasympathetic thing, the parasympathetic nervous system is what's needed to contract the uterus and push the baby out. So think about that. You're going crazy. Everything, the cortisol, the adrenaline, and then you have to stimulate the parasympathetic side of your nervous system to have a baby. Very hard to do. You could be the calmest person in the world, and you could not, unless you're really practiced. This is like basic training in the army. I mean, with sniff enhanced respiration, you got to practice that a lot. But even so, maybe it goes out the window. You would heal. You would heal because you have a very healing body. The body always heals. Even if you tear things, even if you rip things, your body's going to heal unless you continue to place the pressure on it. Okay? And so this is what I tell my patients. Even if you have a bad delivery, you'll get better, but don't keep bearing down. Don't keep pushing because that's when the incontinence really starts to set in. It's not just with the childbirth trauma. It's the fact that you never didn't heal and you continue to do the behaviors that got you here. So I don't even remember how we got onto this particular subject. I tend to go off on tangents with this because
Oh,
my
no,
brain's always like,
it's
what?
completely relevant. We were talking about the childbirth, the hysterectomies, the things that could affect
Yes,
the,
that's right. So
yes.
if you're pushing, this is right. So if you have a hysterectomy, okay, and your ligaments and your tissues and your muscles are weakened by that, don't push on the toilet for dear life. Don't push. Push with air. Because when you push, it's a very different physiology to your body than when you keep your nasal passages open. It's 100% different. When you push with your nasal passages open, you are opening your bottom. You're not putting any pressure on those tendons and those muscles. But when you just bear down, you're continuing the tearing process. And we have the ability to go in either direction, but we have to have the brain function to do it. And that's the mind-body connection. If we don't know about what's going on down there, we'll just do the wrong thing.
I really didn't, I don't think I had many issues until the menopausal window for me personally. And that's when I noticed, like, the thing I noticed was needing to go pee more often. Like, I'd just go pee and go, 5 minutes later, oh, I feel like I need to go pee again. And I was given the advice, well, don't give in to that and try to space it out. Is that good advice?
I wouldn't say it's bad advice. It's just not the advice that I give. Let me explain what happens with menopause, just on a physiologic level. We're losing our estrogen and other hormones too, but estrogen's the big one for us. So that pee pushing pathway that most of us are on, what that means is that when you push a little bit, or you just use a postural maneuver, a little bit of urine is getting pushed past your sphincter. Okay. And that is stimulating the bladder to contract through a spinal reflex. Okay, it's not the actual urination pathway. It's basically a reflexive pathway that allows you to release urine. It's how we urinate when we do have a spinal cord injury, actually. And that's something we learn in early childhood. The problem is that it's an estrogenized pathway. Okay, that pathway is run by serotonin and estrogen, not by the muscarinic and the noradrenaline pathway. These are different neurotransmitter pathway that the actual urination path is on. This one is sort of like this accessory pathway that we use in early childhood, and it's run by serotonin and estrogen. When we lose estrogen, that pathway doesn't work as well, which is why is when we get older, when we're pushing, we just can't get the urine out. It's just because it doesn't work. It was never supposed to work well. It was supposed to be our training pathway. And listen, most of us use this pathway throughout our entire life. But now what I tell people to do is put their finger under their nose. So try this. Put your finger under your nose like a mustache and just smell your finger. Just smell deeply. That's how you pee. You push with air. Because when you do that, you're stimulating a different part of your nervous system to release urine. And when you do that, you have to pay attention not to clamp in response to it. Okay? So from a neurophysiologic level, when you sniff, your bottom will clamp against your sniff. All right. That's the sniff. I call it the sniff and the guard. Okay. Your sniff reflex is going to stimulate your guarding reflex. What you need to do is then inhibit it. Okay. So, and this is all mindful. This is all the mind body connection. So you're sniffing and you're learning to not clamp on the other side. That's how you urinate. We don't want our guarding reflex activated on the toilet with us, or we continue to have problems with pushing out the pee and it's not fully emptying and we have to go right back and it burns a little bit. When you use airflow, none of that happens because the pathway you're using is estrogenized. And sometimes we give estrogen replacement or vaginal creams and everything feels better. The urination pathway feels better. But I would rather you be able to not have to have an estrogen replacement, which I have no problem with, by the way. I really believe that hormone replacement is great for us, but not everybody feels comfortable with that. And I say, okay, so let's just be more physiological about what you're doing on the toilet, and you'll see you'll stop getting the UTIs. You'll stop having the problems.
Yeah, so interesting. I had a problem with the UTIs too when I hit that menopausal window. All of a sudden I was having one after the other and you get caught in that antibiotic kind of around and around you go. And the estrogen cream did help. You're right about that. But I realized from talking to him, I'm a definite clincher. I think
Okay,
it's my whole
that's
body.
the first step. Okay, so the first step, and I tell everybody who talks to me, they go down this. Listen, if you can just incorporate what I'm saying, what's going to happen to you next is you're going to become increasingly aware that you are a chronic butt clencher. And it really is scary because you start to become aware of this process in your body that you are not controlling. See, your guarding reflex has no purpose. It really doesn't. It's something that should have gone away, but it's still in you because you didn't know it was there. All right. So now I tell you, it's okay to notice it. I want you to notice it because it's there. And every time you notice it, I want you to take it down with airflow. Airflow is the only way to take it down. You can't just relax. You have to push air into it. Once you do that, and that's why you have to breathe like this 8 to 10 times a minute throughout the day. Oh my God. How are you going to do that? How are you going to breathe like that 8 to 10 times a minute throughout the day? It means you have to multitask. It means you have to bring your yoga into your life. Okay. And I heard you talking about that with somebody. It's exactly what I teach. Yoga is not something you do for 2 hours on a Sunday. Yoga is your life. And if you understand that breathing is your job and 8 to 10 times a minute, you'll get rid of your clamping behaviors on the other side of your body and you'll bring blood flow to your pelvic floor. And you'll breathe and your body will like you more. And you'll regulate your nervous system and you'll pump out all your emotions because that breath is stimulating your parasympathetic nervous system and it's really like taking Valium. And let me tell you, I got 3 kids. I need Valium. But I can't take it because I'm a surgeon and I'm a mom of 3 kids. We all need this stuff. If we don't know how to do that breath, we'll die. That's our breath.
I'm doing a drink pause challenge right now, 14-day, and my membership to get women to rethink their relationship with alcohol. And it's going to sound weird, but I see a lot of things in common here, because to change those patterns, you have to start to create new neural patterns, and they're all stored as these habits and,
Exactly. So
these triggers.
you're replacing
Yes.
your old childhood habits of I have to hold my pee in. I'm responsible for holding in my pee. All that stuff. You have to replace it with my bladder will never leak on me if I give it air. And it won't. It's this crazy thing. You have to do it something. It's such a different thing. So I tell my patients, when you have an urge to go, just say you're outside, you're at the shopping center, and you're like, oh my God, I gotta pee. This happens to all of us, right? The first thing that happens is you're like, where is the bathroom? Where is it? How far do I have to walk to get to the bathroom? Am I going to
Panic.
make it to the bathroom? And panic sets in. What do you think that does to your bladder? Do you think it helps you hold it? It does not. It goes in the other direction. So that's how people lose pee, because they not only are they feel, so they hear the body's call is saying, I got to go. And the reaction is, let me clamp around you and shut you the hell up and figure out where the bathroom is. And so what I tell people is don't do that. Just take a second and give your bladder a sniff, just a sniff. And you have to take the presence of mind to be able to give your bladder a sniff. And the first thing that happens is your bladder calms down instantly because you're giving it air. You're suffocating your bladder when you clamp around it, and it cannot hold it for you when you are cutting off its circulation. So I want everybody to go in the other direction of Kegeling and trying to control their bladders. When people come into me and they say, I can't control my bladder, I say, that's because you're not supposed to. That's your mistake. They said, well, you want me to pee on the floor? I said, no, I want you to get out of your bladder's way. Give it some air. It will do its job if you stop clamping around it and you're not realizing you're doing it. So this is a mind-body practice that really works. It's just about paying attention to things that we're not really paying attention to.
Such good advice, because my place is where I get in trouble is the car, because I drive around with a water bottle all the time, sometimes bigger than this. I'll do my big Yeti, and I'm drinking the whole time I'm driving. I'm at the gym, I'm downing water, and all of a sudden it'll hit me, and I'm about
Mm-hmm.
5 minutes away from the house, and I'm like, oh
Mm-hmm.
my gosh, how am I going to make
Yes.
it home? So I start clenching harder and
Exactly.
harder.
So now you're going to do something different and you're going to see that what I'm saying is correct. And look, the brain is funny this way. It's a very funny organ. The brain can intellectualize something, but it doesn't actually believe it until it actually witnesses it with its own eyes. So I can sit here telling you, just sniff when you have an urge, and you'll be like, yeah, that sounds like it would work, but you'll be scared to do it. And you'll be scared and everybody gets scared. So make sure you do it in your house for the first time if you're uncomfortable. But when you're in your car and you feel that urge, I want you to talk to your bladder, okay? And that way, the only communication you have with the lower half of your body is through your sniff. Okay, your sniff is your call to your body. How you doing down there? It sheds the light on the other side of your body so you can get an image of what's going on in your brain. It's an internal biofeedback system that we're all born with, okay? So our sniff can sniff to different parts of our body so that our brain gets a feedback of where they are in space. It's part of our postural control mechanism that none of us know about. Okay? Because unless somebody tells you about it, you don't activate it. You don't know how to use it. All right. But now that you know it's there, when your bladder starts to call to you, say, hey, honey, what's going on? Am I stressed? Am I sitting on my muscles, or do I really have to pee? Because sometimes your brain cannot tell the difference until you shed the light. In that moment, you're going to know the answer. Sometimes it's, yeah, I'm full. And I say, okay, honey, we'll be home in 5 minutes. I'll give you some more air until we get there. It's just another way to manage your bladder instead of clamping around it. Because I'm telling you, clamping doesn't work. It's just a childhood reflex that we used at an appropriate time in our lives to get out of diapers, but we were meant to get rid of it, and none of us did.
You're right about that. The clamping doesn't work, because then you're more likely to have that leakage. You know what I call that
Yes.
little leakage until
Yes,
you're
so you'll
until
notice
home.
people see you're very astute. I will say that, Carol. And not, I mean, people don't always know this. Not they don't have the body awareness to understand this, but you'll notice that when you have that urge to go, it's not until you clamp that you leak. Okay? If you didn't clamp, you would not leak, but your sensation to go would get strong because you are clamping your muscles. So just pay attention. Don't clamp and just sniff. It's just, you want to train your brain to do something different. Instead of clamp, sniff, and you're going to see immediately that your nerve pathways are going to start to change. So that when you have the urge, you're automatically going to sniff. You're automatically going to breathe. You're not going to have to think about it because it becomes second nature. Why? Because it works, because it helps, because it's healthy, because it helps you regulate your nervous system. It helps you regulate your bladder. It helps you feel the other side of your body. It's more comfortable. You don't feel like you're burning in your vagina. This is our internal biofeedback system that we have to activate.
Yeah, I do think that our lifestyle we lead it has taken us further and further away from what is natural, from what we're supposed to do in that communication with the brain because of this rushing, the rushing woman syndrome, I call it, where it's, you're going from thing to thing to thing, and it's just the way our society is. Now, I'm going to ask a question. It might sound really silly, but what about, okay, nighttime? You maybe drink too much water before bed, you wake up, and I'm the type of sleeper that if I get up and start to move around, I'm then wide awake. So if I get up, give in, go to the bathroom, and for sure, if I turn on that light, then I'm awake.
Okay, so the night is such a more difficult thing than to manage than the day. And I always have to talk about the psychiatry of the bladder when we talk about the night. It's really a psychiatric organ, the bladder. See, I can tell about people's personalities just by examining their pelvic floors because it tends to mirror what's going on in our brains, and it really does work that way. So what I tell people is the night is not under your control. Okay? Your control is the day. That's when you're conscious. That's when you're aware. The nighttime, you have no control. But if you control what's happening in the day better, your nights will get better. Your night is reflecting your behaviors of the day. And that's how the bladder works. So we see this in kids who are bedwetters. I mean, I don't know if you've known any children or family or you, but when we are clamping, our anxious kids are bedwetters and they tend to be holding their pee, holding very hard all day long. They're releasing at night. So it's a very psychological thing, and it's a nervous system and a psychological thing for a kid. So it's similar to us when we get older and we start getting this nocturia. Our holding behaviors throughout the day are what is getting us up at night. And so when we stop holding, when we just start releasing the bottom muscles with airflow, we will see our nights get better. I know it sounds crazy because, listen, I have patients who have been suffering with things for years, and it's very hard for me to talk to people about this stuff. And, I've had people who've had multiple surgeries. I've had people who've been suffering from terrible conditions with their pelvic floor for years. And they come to me and I'm saying, you just have to breathe. And they're like, what? What? Dr. Fleischmann, you're telling me I've had 5 consultations, I've had 7,000 x-rays and scopes in every part of my body and medicines and this, and you're telling me I just had to breathe? And I'm like, look, I'm sorry. Sometimes the simplest things are the answer, but it's not easy to do. That's why you're not doing it. That's why you didn't know this. So it's really just a better understanding of how the body works for us to understand all these chronic illnesses in our body, especially with pelvic floor dysfunction.
Now, how did you, this is a bit off the topic. I'm assuming you did not get this knowledge from medical school and that a lot of it came after. How did you gain this knowledge about the pelvic floor and really this insight?
So this is what my book is about. It's about how I came to discover this stuff
Okay.
because like you said, I did not learn any of this in medical school, except that I did. And this is the funny part about it. It's just how you process information. You see, when you are, maybe I'm a different type of processor. I don't know. When I pay attention, I make a story about something and my stories weren't working. That's how I learn. I'm not a as detail oriented as I am concept oriented. So for me to remember something or understand something, I have to understand it on a conceptual level. And if something doesn't make sense, I always go back to the foundations to figure out why. And for 25 years, I kept going back down to the foundations and saying, but this thing doesn't make sense. This thing that I learned to do does not make sense, whether it was Kegel's exercises or all the pelvic reconstructions or just watching my patients have a wonderful pelvic reconstruction surgery by me and then they weren't happy. They were leaking or they reprolapsed. And I was like, we're missing something here. And what we were missing was the patient's functional behaviors. That's what we're missing. So we were taught that prolapse is something that happens to women. Maybe it's gravity. Maybe it's God's will. But every force, every action has a force. Bladders don't just drop. Something's pushed them down. And for us not to understand that on a physiological level was really strange to me. And now that you sort of think about it that way, of course I push down my bladder. I'm pushing on the toilet. Of course my bladder is going to take the hit. It's going to be hanging out of me. But we never taught women don't push. You see? So it's just this disconnect that I saw in my own practice, in my own understanding what was happening with women. And I saw it in myself. I saw it in myself. And when I recognized it in myself, I turned it around. And then I realized it was everybody. It wasn't just me. And that's the beauty of having a large female pelvic medicine practice. I get to examine and talk to and interrogate hundreds and hundreds and hundreds of women. And guess what? We're all saying the same stuff. And just nobody's talking to each other in words that we understand. We're all suffering from the same thing, not knowing we have a mouth on the other side that we can open with airflow. And when we learn that, everything gets better.
And it is so simple. That's what I love, because everything that I've heard prior about the pelvic floor, the first time I injured my back 9 years ago, I've had a lot of back problems, disc problems. I had a spinal fusion last summer, whole other story.
A big deal,
Yeah.
yeah.
And then, yeah, that was affecting the pelvic floor coming out of that because you naturally protect your back by kind of tucking your
Yes.
glutes under.
Yes,
Yeah.
of course.
Yeah.
It's a protective mechanism. But you know what that protective mechanism is actually doing? It's hiding that area from your brain. So when you clamp around something, I don't know if you ever hurt your finger. If you just kind of squeeze around it really
Yes.
tightly, you almost don't feel the pain, right? We're trying to cut off that part of our body from our brain. Because our brain, if it sees it, it's going to hurt. So we're almost just clamping around it. But when we clamp around an injury, we're decreasing the blood flow to that injury. So it makes no intuitive sense for us to do that. And yet we do it because it decreases the pain. But at some point, it starts to upregulate the pain. And that's how chronic pain syndromes work. And that's what happens after childbirth, too. So we all have these violent vaginal deliveries. We're clamping even more on the other side to protect ourselves from the pain that we felt either consciously or unconsciously. And we are tightening and tightening and tightening and tightening. And before you know it, we've cut off all the circulation to our bottom. And it's just this, we just have to be smarter. We have to say, this is what our body does when we have pain. Let me know that I'm going to be clamping in an area that I'm trying to heal, and let me give it air. And that's what the internal biofeedback system is. It's just using our brains and what we know to overcome these natural instincts that aren't necessarily good for us. And that's what child development is.
It just makes so much sense to me. You know, that
Good.
first initial therapy that I got for my back so many years ago, I remember the pelvic floor therapy being so complex. Like I felt like I didn't understand anything that the practitioner was saying to me, and I wasn't understanding the exercises and even why they should work and there was this
Good.
disconnect. Yeah.
So I had the same thing happen to me, but here's the difference. I'm going to medical school and learning the neuroscience behind what we're doing. So I can learn the pathways. And when I studied this back to basic science, I mean, this is all scientifically supported. If you go back to the basic science and the rats and the cats and the reflexes and the neurophysiology, everything I'm saying makes sense. Okay. And at some point when you get to the end, and it's like when you do a crossword puzzle, I don't know if you ever do crossword puzzles, but I'm not a great crossword puzzle person, but I know if I get to the end and the last three letters don't make a word, I messed up somewhere, right? I got to go back and figure out where I messed up. And that's what happened with us with the pelvic floor. It's like we got all the way down to the end of the body, and then it just didn't make sense. We couldn't explain it to women. Should I squeeze? Should I relax? What am I squeezing? What am I relaxing? The reason it doesn't make sense is because we have the wrong model. If we understand what we are, a two-mouthed creature with a mouth on the other side that opens with airflow when we urinate and defecate and have a child and have sex, if we understand that that's what we're supposed to do, when anything is released or entered into our bodies. We don't need to think about pelvic floor therapy. Do you think God made us for us all to go to a pelvic floor therapist? Is that, I mean,
I would hope not.
don't you think he would have made a lot more pelvic floor therapists if every woman on the planet needed a pelvic floor therapist? No, that is not what we need. What we need is to understand the internal biofeedback of our system that puts us in the right direction. And that's not something any of us have developed.
So good. Dr. Fleischmann, thank you so much for
This is
being
so
on
much
the
fun.
show. Just the time just flew and I learned a lot from you. So thank you so much. And as we start to wrap up, was there something I didn't ask you or say or we didn't discuss that you would like the listeners to know about?
I just want them to keep their minds open to this because sometimes when we say stuff that's so simple, it just sounds like it's bull.
Mhm.
But it's not. It's necessary information that we missed. And I look at it as a miss and it makes me sad because I think that if we could all sort of take responsibility for the fact that we do have the ability to understand and learn and teach each other, we can change our health overall. And I just really am glad to talk to you and I hope to talk more all around the
Yes.
world.
Yes. Thank you so much. And where can people connect with you? What's the best way?
I guess I don't have a big social media presence. I have to tell you, I'm trying to start to work on that now. I'm really a science nerd and I've kind of hidden in my world. But now I realize that you could probably find me on LinkedIn or Facebook. I do have a website, thesecondmouthbook.com, where you could reach me.
Great. I'll make sure that is in the show notes. I can feel your struggle with social media. It's something I do
Do
kicking and
you?
screaming. I do it because I have to, but boy,
You have to, yeah. It's a great tool, but to me, it's like totally overwhelming.
oh yeah, total time suck from other things that could be definitely more important than that. Thank you again, Dr. Fleischman.
Thank you.
I appreciate you so much. And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.